Mhm. Welcome, everyone. If you haven't been here before, my name is Jen Petit. This is kind of a new restructured council from our Graduate Education and Health Management Leadership Council that we've previously had under NCHL. Um, we've kind of moved you all under the Lens umbrella, which includes 7 or 8 other councils beyond you all. So looking at those councils look at well-being, leadership development, all of those areas, but really hoping that this group can focus on kind of the connection and bridging relationships between the academics and industry partners. So really looking at how we can best leverage research practices, how can, folks in the faculty space provide maybe opportunities for research or papers, how can we um, understand the pipeline from graduate program to early careerist experience and umbrella of things. So excited to have so many of you on the call today and be able to walk through that. But I have the agenda. We're doing new agendas here in 2025 where they are linked instead of a PDF. So hoping that that's a little more 21st century for you all and makes it a little bit easier to see. But I wanted to go around the room real quick and do introductions since we have lots of different folks on the call. I know Bob has a little bit of sickness, so I will pass on him, have him do a wave. But we can start with Forrest and then just pop one around.
Great. Good morning or good afternoon, everyone. My name is Forrest Dent. I'm at Baylor University. I co-direct the healthcare MBA here, as well as direct the Robbins Institute for Health Policy and Leadership. It's great to see you.
Kelly, do you want to go next?
Hello, I'm Kelly Scheider from Ohio State and program director for the MHA program. Just celebrated my 1-year anniversary in this new role for me. So thanks.
Okay.
Hey, Jen, I think that everyone probably has a different order on their Zoom screen, so you may want to just call folks out.
Yeah, no problem. I'll call on you, John, if that's okay.
Shouldn't have said anything. So, John Catalano, I am the director of the residential MHSA and MPH programs at University of Michigan, but my heart does still belong in North Carolina with Jeff at UNC Gillings, where I'm still an adjunct professor.
Fantastic. We'll pop it over to Jeffrey because you got a shout out.
Thanks for the shout out, John. Once a Tar Heel, always a Tar Heel. It's good to see everyone. I'm Jeffrey Sims on faculty at UNC, Associate Chair for Alumni and External Relations, and work predominantly with the master's students, but all of our degree programs. You want me to pop it along? How about my colleague Karen who's also from UNC?
Hi, everyone. I'm Karen Volmar and now former MHA program director. I'm serving now as the associate chair for academic programs. It's great to see everyone. Let's see who is up next. Jared, you're up next on my screen, at least.
Hi there. Good afternoon, everyone. My name is Jared Stone. I am a group practice director at Henry Ford Health in our surgical divisions, and I also am the coordinator for the Administrative Fellowship Program.
Thanks, Jared. I'll pass it over to Randa, who I feel like I haven't seen in years, but good to see you, Randa.
Good to see you. Good to see everyone. Randa Hall. I'm with the University of Alabama at Birmingham, and probably shouldn't say this out loud. My title used to be pretty much what Jeffrey's was, but development didn't like how it sounded. So now, let me tell you my new title. No change in what I do. Associate Chair, Industry Partnerships and Strategic Collaborations. Now, how about that mouthful? But I do work with all the alums within our department, about 5,500, and try to find ways to keep them engaged once they leave the classroom.
Fantastic. well, happy for your new-ish revamped role, whatever that looks like. We'll pass it on to Michael.
Hi, everyone. I'm Professor of Public Policy at Cornell and the director for our residential MHA and executive MHA programs. This is my first year. I'm solely in the director role. Maria Thompson has not fired me yet, but we'll see what next week holds. And maybe Maria can introduce herself.
Thanks, Michael. I'm Maria Thompson. I am the Director of MHA Admissions and Student Services at Cornell. I work with both our full-time students and our executive students, and I've been here for 9 years now. And before that, I was actually at Kaiser Permanente, so working in industry.
Thanks. Good to have you here. Who am I missing? Ed, I think.
Hey, everybody. I'm Ed Schumacher, the chair and program director here at Trinity University, and happy to be here. I do have to bounce off to a meeting in just a second, but I at least wanted to come in and say, hey, everybody, and I miss seeing you guys and hope to get to be here soon. And I'm representing North Carolina, so where my hometown. So anyway, live in Texas, but my heart's in North Carolina.
Seems to be the trend, huh? How about Paige?
Good afternoon, everybody. I'm repping Virginia Commonwealth University, which is where I'm the MHA and MSHA program director. It's good to see everyone.
I'm missing Justine.
Hi, everyone. Happy New Year. I'm Justine Mishek, Associate Program Director is my new title that made FS curriculum for across both programs. And Katie White is not here today. She sends her regards. She's the overall program director for the MHA program that will be on these meetings from time to time as well.
Fantastic. In my line, Jamie's up next.
Hi, everyone. I'm Jamie Jennings, and I am at the University of Alabama at Birmingham and the program director for the residential format of our MSHA.
Awesome. And Sue, good to see you.
Hey, I'm Sue Boren. I'm the MHA program director at the University of Missouri.
Fantastic. Who am I missing? I know I'm missing someone. I know Stephen is in transit. Yes.
Hi, I'm Arab Dabali, I'm chair of Health Services Management and Policy. So Kelly works with me, Associate Dean of Grad Studies here also. And I guess I'm here repping the VA where I worked for probably about 2 decades or so, although I'm not there anymore.
Fantastic. And I've left our presenters for best for last. You'll notice that a lot of you are from the graduate program side. We're actively working with our 11 premium members on the Lens side. So you'll see that those folks are invited and we're working to get more of them involved in this council. But I will leave it to Shanna and Hazel to kick us off with their presentation.
Thank you, Jen. So I think Hazel is going to share and we'll introduce ourselves as that comes up.
Yes. My screen is loading. That's why it's taking.
Gotta love technology.
I know.
It's Friday.
Yes.
Yes, it is. Yes, it is. So in the meantime, I'll introduce myself. Hello, everyone. My name is Shanna Dakin Pereira. I am the Assistant Vice President in the Office for Diversity and Inclusion at the Mount Sinai Health System here in New York. I wear a couple hats in the office, but one of those hats is overseeing some of our pathway programs. I also oversee our administrative fellowship program and have since its inception. And I'm also very excited this year to also be working closely with Malia as a co-chair of NCAF. So I'm really excited to be part of this group and to offer this presentation. with Hazel, who is actually one of our former fellows, but now works with our team as well. So Hazel.
Yes, thank you, Shanna. And hi, everyone. Happy Friday. My name is Hazel Rogers. I'm the Assistant Director in the Office for Diversity and Inclusion. I assist some of our pathway programs that we will be discussing today. And as Shanna mentioned, I started off my journey at the Mount Sinai Health System as an administrative fellow, and it has changed my life in a positive way. And I'm just happy to meet all of you and really get to showcase some of our work here at the system. Thank you.
So we'll be presenting very briefly today on fostering health careers and empowering youth through innovative pathway programs at Mount Sinai. This is a presentation we gave in its full entirety in November at the NCHL conference. And so excited that Jen invited us to offer some of this presentation here in this meeting. So, it will be, of course, shorter than we did at the conference. But of course, if you have any questions, you're more than welcome to reach out to us afterwards. I also want to caveat this by saying the programs that we'll talk about today are mainly for high school age students. However, the process, things that we did during the sessions can, of course, be applied to students who are in college and graduate school as well. And we certainly have internship programs for those audiences. So, again, if you have any questions, we're happy to answer them and to also speak offline with any of the processes we share today. Okay, so just to start off, wanted to give an overview of our Office for Diversity and Inclusion at Mount Sinai. So our mission is to support the Mount Sinai Health System in embracing the principles of diversity, equity, and inclusion as key drivers for excellence and innovation for unrivaled healthcare delivery, medical and health education and research. And the latter part of that statement is actually from our Mount Sinai Health System mission. So we're here to support the mission in the space of DEI. Our vision is to uphold, anchor, and operationalize equity by embracing new methods of thinking and emphasizing fairness, ultimately to empower and uplift vulnerable and marginalized communities in all that we do and seek to achieve. And what that really means for us is that equity is at the center of all that we do. When we're planning programs and initiatives, equity is always the foundation of that. And operationalizing it is just how we carry out that work so that everyone could really value equity for what it is. And then what we do, Hazel and I and the rest of our team in ODI, we serve as subject matter experts and consultants to our internal stakeholders at Mount Sinai, but also to our external stakeholders, the community partners that we work with. So we advise on policies and procedures. We do a lot of education and training throughout the health system as well. And all of that is ultimately to enhance the patient experience for all. Next slide. So hopefully by the end of today's presentation, you'll be able to understand the resources and the structural elements necessary for creating equitable and sustainable pathway programs in a large academic medical center. We'll speak to two programs in particular today that we have launched and developed over the past couple of years. And Hazel has been extremely instrumental in that and leading those programs. But you'll see our process in terms of how we develop them. You'll gain some insight into the tools and methodologies we use to establish these programs, which ultimately address health equity and social determinants of health, but also connect youth to career pathways in healthcare. And then finally, we'll speak a little bit at the end about lessons learned, some areas for improvement that we noted, and some best practice as we continue to grow and expand some of these programs within Mount Sinai. Next slide. So our programs. Of course, every program answers a question, right? And really, when we think about the challenges we faced over the past couple of years, that really led to the development of some of these pathways. So our first challenge, and the challenge that many of us have faced, and really combated in different ways, of course, COVID-19 caused changes for everyone. And for us, at Mount Sinai and in New York, which was the heart of COVID at one point, it really accelerated the nursing shortage. It underscored the need for innovative solutions to really attract individuals, but especially youth to the profession. So we saw large, groups of nurses leaving the profession. And it really led to the question, well, how do we attract new nurses into our health system? So we created a nursing pathway program. And the goal of the program is really to provide mentorship and practical experience to expose and empower students to pursue a wide range of careers in nursing. Now, I did note that our program is for high school students. And of course, high school students don't just graduate and become nurses. But what's really great is that we are partnering with New York City Public Schools and attracting the students who we recruit into the program. One, have a demonstrated interest in nursing. Two, are attending a health professions-based school, high school in New York. So when they graduate, most of these students who are graduating from these programs obtain preliminary certificates or licenses to become LPNs or to go on to nursing school to get their RN. So we're really specific in terms of where we recruit. And then, of course, within the Mount Sinai Health System, we also have a nursing school. And so part of this is also to inform these students that, hey, you can come to our nursing school, and then that creates a pathway into our health system to obtaining a career. So we really have the long term in mind when we're creating some of these programs. Our next challenge was, of course, addressing social determinants of health. And so we know that social determinants present challenges for youth, particularly those from underserved and marginalized communities. And, when we're thinking about what kind of challenges they present, it often hinders their ability to thrive, engage, and access support needed for their success. And also, it prevents them really from learning about what are the other pathways in healthcare or in other institutions for me to obtain a career once I graduate from school. And so our response was creating a youth advocacy program. This program is specifically to address climate change and environmental racism. The purpose of the program is to educate students about health equity and the systemic inequities and disparities caused by environmental factors, but also to engage them in becoming advocates in their communities. And I mentioned earlier that equity is really central and foundational to all that we do. And so when we think about what were the key areas of success for both of these programs, it really led to strategic partnerships, not only with internal departments who we were able to bring in to educate the students on different professions or different areas of focus, but also just to mentor and guide these students as they were in these programs. We also relied on a lot of internal collaboration and then focused on youth empowerment, right? What would encourage youth to not only apply for this program, but how can we keep them engaged while they're here? Youth don't just want to come to a program and sit and be lectured to all day. So what are the things that we can build into the program to make it really engaging for them, make it so that they're not just sitting in their seats all day, they're getting up, they're getting involved, they are really learning through doing. And so Hazel, as I mentioned, was instrumental in creating a lot of the curriculum for these programs to ensure that they really had a broad experience. So I'll pass it to Hazel to go through our process for developing these programs. And then again, we'll wrap up with some lessons learned.
Thank you, Shanna. So yes, as Shanna mentioned, we have really built out both of these programs. First, I'm going to discuss our nursing pathway program, which was launched in 2023. And this was a collaborative initiative between our office, which is the Office for Diversity and Inclusion, and the Department of Nursing. As we were building out this program, we wanted to, again, highlight how we can continue to keep our students engaged over the course of 6 weeks. But really, this was also important for us to expose them to the diverse career opportunities that are here at Mount Sinai to really foster that early interest in nursing. So as you can see here, we partnered with our Phillips School of Nursing to provide a simulation lab for our students, which was a really interactive and exciting opportunity. As you can see, some of our students are very excited just to work on mock-up patients, really get that exposure on what patient care looks like and how to provide excellent patient care here specifically at the Mount Sinai Health System. And then we also celebrated our students at the end of our program where they were able to showcase some of their projects that they focused on, which was highlighting different social determinants of health and how that impacted specific communities within their neighborhoods, and as well as having just a celebration with our senior leadership team and their parents as well at our graduation ceremony. So in each program that we have built out in the Mount Sinai Health System, and specifically at the Office for Diversity and Inclusion, we have a specific program development process. So through this section, I'm going to walk you through what that looks like in a more short just guideline. But again, we are always here as a resource for you all if you have any questions. So again, in order to build out a program, you want to understand the why. So we had to conduct our needs assessment. So as Shannon mentioned earlier, COVID-19 really accelerated the nursing shortage. And we also noticed that there was a great exposure of students across the New York City public schools who actually wanted to get into the nursing field. And we wanted to create this opportunity to engage and create opportunities for them that they might not have had within their high schools. So again, we also wanted to have an opportunity to support our own employees who work at the Mount Sinai Health System, and essentially by growing our own. So we have partnered with our 1199 SEIU union employees so that we can recruit students who their parents or guardians work at the Mount Sinai Health System, because we always want to enhance our pipeline and again, give back to those employees who dedicate their time and experience to making our healthcare system a more exceptional institution and organization. Again, our goal was to encourage and inspire youth to pursue careers in nursing and start at the high school level. So as you can see here, we have our Vice President and Chief Nursing Officer, who was extremely instrumental in assisting us in building out this program as well. And she was here talking to our nursing pathway program students and really just kind of exciting them and really gearing up their interest and their participation in the program. One thing I will also highlight too, which is something that we are extremely proud of here within the Office for Diversity and Inclusion. When we first launched our program back in 2023, we started off with 14 students, and now in 2024, we were able to recruit 100 students. So that is a big gap and a big increase, but we are extremely proud of the work that we have done, the internal stakeholder engagements and the partnerships that we were able to utilize and work with to really build out this program and be instrumental resources to our New York City public schools and our youth. So it definitely takes a village to build out these programs for any of our youth and any programs, even within the healthcare system. So again, as I mentioned earlier, we partnered with our 1199 SEIU to engage children of our own employees to be a part of this program. And then, as I also mentioned, we also collaborated with our New York City public schools to offer an additional 80 plus students of diverse backgrounds to have an opportunity to gain this exposure at the Mount Sinai Health System. We also worked with our New York City public schools to ensure that our funding requirements were met. So we had to ensure that each student who participated in the program were participating for 6 full weeks and completed 150 hours at the end of the program. We also could not have done this without our nursing department and our nursing field, nursing leadership, as well as our nurse managers. So with each student, we were able to place them with a nursing leader, specifically at a unit. Through that, we were able to create a sense of mentorship for them. But even before that, we also engaged their nursing leaders to work with our diversity councils and our employee resource groups across the Mount Sinai Health System to help and identify and recruit these preceptors, right? And then we also partnered with our human resources department as well as our volunteer services department to connect our 1199 SEIU members to facilitate the onboarding. And each student within the program was given a volunteer jacket. And this was a sense of pride and identity that we wanted to create for the students to make them feel like they are a part of our Mount Sinai Health System. So again, as I mentioned, we were able to partner our students with different nursing leaders and nurse managers across the system so that they can gain mentorship. and really see and expose themselves to everyday lives of what a nurse does within the Mount Sinai Health System. But then we also had other areas to where they can learn about professional career development and career exposure. So every Monday, our office hosted Learning from Leaders. And that was a really nice session because we were able to work with different departments across the Mount Sinai Health System. And it really wasn't specifically geared for nursing. We wanted to expose them to a wide array of different types of leadership and different types of careers that we have to offer at the Mount Sinai Health System. So as you can see here, we have Shanna, who was our moderator with some of our panelists, where we discussed mental health and well-being and the importance of prioritizing self-care. As many of you know, the younger generation is definitely bearing the brunt of social anxiety. And so we really wanted to ensure that they are prioritizing their mental health and well-being, especially as they are here in the Mount Sinai Health System and providing the best resources for them. Tuesdays through Friday, we again place them with their on-site mentor so that they can get that hands-on experience to really understand what a day in the life of nursing is really all about. And then at the end of our program, they were able to showcase what they have learned, as well as their social determinants of health project that they worked on at the end of the program, and they were able to highlight that at the graduation ceremony. And additionally, every Wednesday, we would host afternoon DEI sessions, which focus on an array of topics such as people with disabilities, LGBTQ plus best practices, unconscious bias and cultural awareness, as well as health equity. So we wanted to, again, give our students the overall understanding of what diversity, equity, and inclusion means. How does that impact the communities that we serve, and what can we do about it here as healthcare professionals to continue to treat and improve the communities that we serve? And every week, we always incorporated feedback from our educational partners, as well as our healthcare professionals, even our students as well, just to see how the program is going, if they're enjoying it, and if there's any feedback that we can do to really just make changes as we go along throughout the 6 weeks. So for resource allocation, the Office for Diversity and Inclusion and the Department of Nursing were on call throughout the entire program. We definitely had the opportunity to connect with each of the students through in-person Q&As on Monday. We also have virtual office hours, and then we also provided bi-weekly check-ins and via emails as well. I will say that most of the students have my cell phone number, so they were calling nonstop, and that was perfectly okay. If there was ever an opportunity where I needed to go to a certain site just to make sure that everything was okay, and just give them any type of reassurance, that is something that I felt more than willing to do, and a lot of my other colleagues as well. But we enjoyed it because we always wanted to be a guide and a resource for them, and to let them know that this organization is huge, but you are not alone. And here at the Mount Sinai Health System, we are more than willing to and want to support your growth in every way possible. And then again, we just continue to incorporate the feedback that was necessary for our students. So moving forward, we conducted a post-program evaluation for our students, our preceptors, and the parents who are Mount Sinai Health System employees, to really get their overall viewpoint of how the program went, any challenges, any areas of opportunity and growth. We also conducted listening sessions with our nurse leaders to obtain additional feedback. And then moving forward, we are going to increase the program capacity again. We are going to diversify our recruitment channels. We are thinking about recruiting from different employees as well, and additional employees as well at the Mount Sinai Health System, who are not just only 1199 SEIU employees, to, again, just enhance and create those partnerships. And as you see here, this is one of our program interns' final project, where they discuss the improvement of treating Black women and infants in maternal care. So for our second program, this is our youth advocacy to address climate change and environmental racism. So this program was also launched back in 2023. It is very interesting how this program came about. When I was an administrative fellow, I attended the Aspen Health Ideas Festival in Colorado. And while I was there, myself and our senior vice president had an opportunity to connect with the CDC Foundation's president. And we were discussing different environmental hazards and what we could do to really improve the underserved community. So from there, I wanted to create a program that really targeted our youth from marginalized communities to expose them to the intersections of climate change, environmental racism, and public health, but really focusing on that health equity lens. So we were able to partner with the Department of Spirituality and Health to create this youth advocacy program. As you can see here, we have exposed our students to different field trips opportunities. So over here to our left is a field trip that we took our students to, which was called Harlem Grown, and it is a local urban farming in the city of New York, which was really interesting because I never knew that that was even an option for the different communities. So, and neither did the students. So it was really important to just show them the importance of healthy eating, sustainability, and urban agriculture. And also, this was really helpful because they were able to expose their parents to this resource that they have for the community. And a lot of these students and their parents actually go to Harlem Grown every other weekend to help farm and as well as to pick fresh produce, which was really exciting to hear. And then over here to my right, we have our youth advocacy program graduation ceremony. So similar to our nursing pathway program, these students were able to receive certificates, but also highlight and showcase all the work that they have done throughout their time here at Mount Sinai and create a project focused on social determinants of health and create ideas and solutions to really tackle environmental racism within their communities. So again, we always want to follow the program development process phase. So again, what is our why? We understand that social determinants of health present challenges to individuals of underserved communities. And COVID-19, as you all know, really shed light to the many disparities, especially those in underserved communities who also face environmental challenges as well. Environmental racism also significantly contributes to health inequities and also pushes forward that adverse health outcomes that we tend to see when we're dealing with different patients as well. And it was really our mission to empower young people to understand that they have a voice and that just because they are a certain age, that is never too late or too early to respond to these issues into their community. And we hope that they continue to pay it forward and learn really how to advocate for a healthier community and a health and equitable community for all. So in order to build this program, we actually partnered with our local faith-based organizations across the New York City public schools to recruit and engage students. The reason why we wanted to also tap into our faith-based organizations is because through the Department of Spirituality and Health, we were informed that a lot of the congregations in New York City were actually discussing environmental racism within their congregational services. So we thought if they were already having these conversations in the churches, why not expose the youth more in depth to these conversations and have them have a seat at the table to really learn about what is happening, how can they create opportunities to really understand how they can tackle these changes and what to do about it. We also work very closely with our community-based organizations to organize field trips and really wanted to provide students with hands-on exposure to environmental health, public health issues, as well as racial inequity issues. And then we also wanted to engage our youth advocates in guided research projects. So we partnered with our New York City Youth Voices to allow them to analyze data. And we worked with our Intergenerational Change Initiative workshop to really focus on how they're able to conduct surveys, what these surveys mean, and then what they can do with this information. Our internal stakeholder engagement, we could not have done this without the support of our Icahn School of Medicine. We work very closely with faculty and subject matter experts to lead educational sessions. Some of our conversations were like housing, air pollution. We even discussed the connection between spirituality and environmental health and how it is our ethical duty to ensure that we are taking care of the environment. So in every session that we provided with the students, there was always a hands-on activity so that they are able to connect the two initiatives as well. Again, as I have shared, we developed this curriculum over 4 weeks. and to really highlight the public health, environmental racism, and advocacy development. We also have an opportunity to partner with the Museum of the City of New York, which was a field trip that we were able to really expose students to activism across the New York City, just over many of years. And this was actually a really powerful field trip for our students because they were able to really make the connections of issues that are happening in the past and how some of this stuff is still reoccurring even at their age. So for example, one of our tour guides here, as you can see, she was discussing with our students about the segregation that students still face in New York City, which was actually a complete shock to me because I would think that given that New York City is one of the diverse cities in America, there is still a lot of segregation that these students face on a day-to-day basis. So it was just really touching, and the students felt that this opportunity was helpful for them because they were able to be vulnerable about some of the challenges that they face as it relates to advocacy, environmental, and as well as just overall segregation and inequities that they face in their communities. As always, as we're building out this curriculum, it is important for us to incorporate feedback from our students. So every session that we have, I always talk with the students for about an hour just to understand what their likes were, what their dislikes were. And each week we were able to just kind of tweak it as we move forward. For example, a lot of our students were really into the entertainment industry. So I was able to connect with someone from Spotify to come in and speak to our students about how to get into the entertainment industry. And they were really excited about that. So that was exciting for me as well to see smiles on their face. For resource allocation, every ODI staff was present at each session throughout the program. And again, we had educational daily feedback and reflection sessions, always having weekly check-ins with our faith-based leaders and their parents just to let them know how they're doing. And if there's any issues or if there's any questions that the parents might have, because it was really important for us to ensure that the parents felt safe with allowing their children to come spend time with us. And I literally treat these students as if they were my little brother or little sister. So I was with them every single day, just making sure that they were enjoying this experience as well. So for evaluations and next steps, moving forward, we will be merging this program with another established program titled, and the new name will be Racial Justice and Youth Advocacy. We will be exposing our students to a wide array of different topics. So it's not just environmental racism. We will be exposing them to maternal health, gun violence, incarceration, public health, racial justice issues, social justice issues. And what's really unique about this new program is that this will be a year-long program. So there's going to be different pathways that the students can enter through. So for example, we have a mentorship track. We're going to have an academic hybrid option, and we will still continue the long summer youth exposure programs as well so that they get that hands-on experience. And I am going to pass it over to Shanna to talk about our lessons learned.
Thanks, Hazel. So, I think a lot of this you can see throughout the presentation, but just to highlight a few items here. Adaptability is key. I say that especially because these two programs ran concurrently and alongside other pathway programs that we manage throughout the summer. So when Hazel says, ODI staff were at every session, we were spread pretty thin, but I think the joy of that, as many of you know, working with students is that you get to see students learn and grow and develop. And, as they're asking questions, you can see that they are getting engaged and interested in pursuing careers in healthcare, which was really the benefit of this program. It's really what we wanted. So it was really important for us to be adaptable and agile. And, as we state here, individuals involved in managing the programs have to be flexible. Right. So, you have to be flexible to meet the evolving needs of the participants to keep them interested. As Hazel said, she added in a Spotify session because that's what the students were interested in. Right. And it showed that we were listening to them. So active listening was also important as we had these programs. Resource allocation. obviously crucial, right? So securing the adequate financial, human, and organizational resources is essential for sustainability and long-term impact. We were really grateful to have the support of our Department of Nursing financially to run the nursing pathway program for 100 plus students, and then to have the support of our Department of Spiritual Care to help us with the youth advocacy program. And as we look toward the future, as we look towards this year, we've actually applied for a number of grants that we're looking to hear back from to continue to support these programs and even expand them. So finances are certainly key, but also human capital, right? Tapping into our internal resources at our medical school, at our nursing school, to come in and speak to the students and inspire them throughout the program was also key. Mentorship is transformative, right? We had a number of mentors throughout the program, not only those internal subject matter experts who spoke to our students, but even members of our own team who came and encouraged the students, answered their questions. All of that was really important and hearing feedback from the students was key as well. I remember probably a couple months after the program, I received an email from one of the students who participated in a nursing pathway. His parent is actually an 1199 parent who works at Mount Sinai. And he reached out to me for a recommendation letter. He was applying to an honor society and he really enjoyed his time at Mount Sinai and wanted me to write a recommendation letter for this honor society. So it was really touching, not only that he reached out again for that, but that these students, they really look up to you and they keep you posted on their progress. So we know that it is a transformative experience. And then of course, community relationships are also essential. We cannot have held such a robust program without forming relationships with some of the organizations Hazel mentioned, like Harlem Grown and others, so that we can expose students to what is in their own backyards that they can tap into to support their growth and development. Next slide. And then in terms of best practices, again, this is also seen throughout the presentation, but it's important that we understand the barriers and tailor programs to the needs of the participants. Again, keeping in mind that these are students, they're learning, they're young, and we want them to continue to grow and develop. So identifying what their needs are and then developing programs that are responsive to those needs is important. Establishing strong partnerships as well. I mentioned and we alluded to the partnerships both internally and externally. But as a healthcare institution and as one that is always thinking about what are the needs of our community and what are the patient communities that we serve, we want folks to know that Mount Sinai is here for everyone, right? Not just only when you come into the hospital to receive care, but it's a place of learning, it's a place of development, it's a place of growth. And so establishing those partnerships and letting our community partners know what we can offer to students is important. Creating a holistic approach and providing a hands-on experience is also key, and building that into our curriculum development. We know that people learn in different ways, right? So that's why we had hands-on experiences. That's why we had lectures. That's why some of our sessions were panel discussions. So they saw multiple people at once and could engage with them. And I'll also say that they were both virtual and in person. So we had hybrid sessions, we had in-person sessions, we had Zoom sessions, we had office hours where we were accessible to students if they had questions. So when we say forming a holistic program, it's really considering all the ways that people learn and building in aspects of our program that spoke to all of that. And then last but not least, measure impact and success and tweak as necessary to ensure sustainability. So Hazel mentioned the importance of our evaluations, not only of the students who participated in our programs, but also of their parents, also of those internal stakeholders who we tap to present to the students, and really getting feedback from all aspects of the program so that when we thought about expansion and what expansion looks like for this year, we can build that into the program. So as we're currently thinking about curriculum for this summer, we're considering and looking back at all of those testimonials and feedback we received so that we can make the program bigger and better. All right. So that is our presentation. I know that was really quick, but I hope that inspired some of you as you're building out programs for students. Again, even though these programs were specifically for high school students, I think what we learned from them and the best practices can be applied to really any educational level in terms of keeping folks engaged and trying something new and being innovative. A lot of people have never heard about a program just for climate change for high school students, and we were able to develop that at our health system. So feel free to reach out to us. Um, I believe we can probably provide a copy of the presentation to Jen to share with everyone as well, and it has our email addresses. So we'd be happy to speak with you further.
Thanks, Shanna. And if anyone has any questions, I see Jared unmuted. Feel free. We would love to take some questions while we have you on the line.
Yeah, sure. I'll go first. First of all, thank you guys so much for the very informative presentation, and I can really tell like the impact that you guys have made in your community. It's really inspiring to kind of see that, and I'm particularly excited about it because with our fellowship program at Henry Ford, each year we have a community project, and so we have our fellows participate in a community project either individually or as a group. And this year we've elected to have them work on the development of mentorship and internship programs for high school students in the Detroit
Nice.
area, which of course serves a very diverse population. And so I was taking some notes as you guys were talking, and I would love to perhaps connect you guys if you would be open to meeting with our cohort of fellows and just kind of talk with them about being maybe a little bit beyond some of the lessons that you learned. I can also send them your presentation in advance. But this is really great, and we're looking to replicate something very similar in our area, in our community. So thank you. And I guess with that, I did have like maybe one or two questions.
Sure.
So for the nursing pipeline internship program, did you say that you did it during the summer? It was like a 6-week stint. Did you do
Yes.
any commitments during the school year or during their academic year outside of the summer, or did you just focus on the summer?
Yeah, so we focused on the summer for this program, but it doesn't mean that there haven't been talks about doing stuff during the academic year. I know even a few of our diversity council members who happen to be nurses, Hazel and I have had a few conversations with them in the past to do career talks at schools, and even starting younger, even junior high school, to get them interested in the profession earlier. So we haven't as yet, but it's definitely been spoken about and hopefully in the works in the years to come.
Okay. Thank you. And then I guess one other quick question would be, so the types of things the students were learning, obviously it's very observational, interviewing format, et cetera. Did you have them doing any tasks in the spaces? And if so, how did you kind of navigate any kind of need for certifications or licensing or anything like that with them being high school students?
Yeah. Hazel, do you want to comment?
Yeah, I would just say that we made sure that they were not actually touching the patients at all because they are high school students. But it was just more so like shadowing if, like, let's just say the student wanted to kind of see or observe something with a nurse, if they wanted to go to like a surgery room, they could see what was happening, but they could not touch. So that was really important. And we stressed that a lot with the nurse managers, the preceptors, and even just all the other nurses that were on the floor as well, to just make sure that everyone was on the same page, that our students could not actually provide patient care for patients.
Yeah, and that's also why we ended up assigning them that small project to do as well, based on the experience that they had over the summer or what they were observing, putting together. I think the exact project was putting together a brochure that spoke about the issues that they observed and how they can improve it. Right. So, for example, if they were working on a maternity unit, and making observations there, then their brochure spoke to matters that they observed and how they can improve practices on that unit. So we wanted to include that project so it wasn't just I'm going to my internship and observing all the time, but they were actually learning something from it and had to produce something at the end of the summer.
Great, thank you.
Okay, I see Jeffrey and then Michael.
Great, thank you. Amazing work. Kudos to y'all for the impactful work you're doing there. I think we always do a great job of exposing high school, middle school students to the clinical side of healthcare. Tell us, were there opportunities or have you figured out ways to remind students, these young people, that there are other pathways in the healthcare side, especially yourselves, both of you being in more the management side? I know I would love to hear if you have thought about that. Also, I'm assuming in your evaluation, you're going to track these students and kind of see where they land, but it would be interesting to just kind of hear your perspectives about that.
Oh, absolutely. Absolutely. So I mentioned at the top that these are only two of our pathway programs. We do have another summer internship program. It's called our Operations and Administration and Operations Internship Program, where we actually place students in a variety of departments across the health system. So those departments include, but are not limited to, real estate services, our IT department, which is called Digital and Technology Partners. We place students in Department of Nursing, but administration. Also, our healthcare administrative offices in the hospitals. We've also had interns work in our Center for Advanced Medicine, which caters to the LGBTQ plus population, but again, in the administrative space, in that department, food and nutrition services, marketing, communications. So you name it, we've probably had an intern in those areas. And that's the purpose, especially to expose them to other healthcare careers and let them know that, yes, the clinical part of healthcare is important, but all of these other support services keep the business running. Right. So we certainly have interns in other areas. And in that particular program, we have what we call an awards and recognition ceremony at the end. It's also through the summer. So for our graduate and college students, it's usually 10 weeks. For our high school students, it's 6 weeks. And at the end of the program, during the recognition ceremony, all of them are presenting their projects to their peers and preceptors and what they learned. So yes, we have a robust focus on that as well.
Great. Thanks for that. And maybe just a plug for all of us, if you have a platform or opportunity for us to be able to talk about graduate education in health administration, I know we would sign up to be able to come and try to present with us virtual or something like that. Thanks. But
Wonderful.
again, thanks for all the great work.
Thank you. Michael?
Great. And thank you both for spending time with us and a nice presentation. I just had, kind of one half-baked idea come into my head as I was listening to your presentation. So a lot of exciting movement and momentum. You go from a dozen students to like 100. You're thinking about having programs not just in the summer, but maybe year-round, maybe partnering with different provider organizations in different cities and localities. All very exciting. And then I heard you say, which doesn't surprise any of us, you got spread real thin, real quick. And, when I'm looking at all the different programs represented on this call, it would not, as you are, trying to scale and you're running out of people and time fast, it wouldn't surprise me if each one of us in our respective programs has students who would be very interested in being involved to help provide some of that support that you need, and meaning like volunteering hours. Maybe that's during the summer, but even during the school year. I think a lot of us have students who really like to be connected outside the classroom, invest in a program with a mission that they believe in. And so I think, I would encourage you to think about, are there things on the back end where some folks could work remotely? So they could be in Columbia, Missouri, they could be in Ithaca, New York, they could be in Texas and across the country. Are there things where you need some people on the ground? So maybe look at the New York City, programs or folks close to Detroit, wherever the geo center is. But I think, that would be a great opportunity to engage the students that are in our program to invest in these mentorship programs for younger folks. And then also, as another kind of bridge to what Jeffrey had brought up of letting them, get some exposure to some people who are going in this professional management track in the healthcare space.
Yeah, thank you so much for that recommendation, Michael. And I mentioned in our presentation that we are and are currently and will continue to do so, seek grants to support this financially. And yeah, I would love more interns and volunteers to help us out. But I also know students love to be paid these days for those opportunities. So that's always been, the conundrum in hiring more students to help us out. But I would also offer, if any of your programs, and I know some colleges do this, also offer internship or volunteer opportunities for college credit or graduate credit. That's also a space that we've, started to talk about and look into. So if that is something that exists at any of your schools, we definitely be willing to hear about that and work out a way that we can invite more students to participate with our programs.
We did have one more question in the chat from Bob. He was asking about going back to the observation piece of the program, if you had to seek approval from the patients that were on site for those high school observers.
Yes. So what we would do, typically what our nurse managers would do, they would always ask the patient first, like going into the room, if they could have a student with them. If not, then that student during that time will go with a different nurse manager or a different nurse leader while that nurse manager is taking care of the patient. So yeah, we don't just bring the patient, we don't just bombard the patient with the student. No, we always ask if they're comfortable.
Well, we had a whole list of other questions and time for discussion, but this was a fantastic presentation that you both presented. I want to plug a couple of NCHL things as we wrap up in typical Jen fashion, but you should have received or you will be receiving several emails from either myself or Malia over the next couple months as we're gearing up for both of our summit events. Our spring summit event is focused in leadership development, well-being, environmental sustainability. What else am I missing, Malia? Talent analytics. I think those are our topics. And then a lot of our academic industry partnership conversations will happen at the November event, just because we know how busy spring is for you all. And April and May are like, don't touch my calendar, don't talk to me. So continuing to have that summit aligned with the Gail Warden event in November. I do want to plug that our call for content is open. So for both of those summits, we have call for content for all of the content areas of our Lens councils. So like this presentation, if you have, other programs that you all are putting on or work that you're doing in the field, would love to see that and be able to elevate that to all of our Lens members and the NCHL community. I think those are my two big updates. But with that, it was good to see everyone. As always, if you have questions or concerns about membership, feel free to reach out to me. But looking forward to seeing everyone in the next couple months. Thanks, everyone.
Thanks, y'all.
Thank you, everyone.
Thank you.